CLL tests depend on the stage of presentation to you as the clinician. When I first meet a newly diagnosed early stage patient, we tend to run a basic blood panel. I tend not to do more specialist tests such as bone marrows or CT scans at that stage unless the patient is unwell. Of course, I'm guided by the patient. Some patients are very keen to get more what we call specialist prognostic information, and if it's right for that patient, then there are further tests we can do. Yes, so I think the first line of genetic testing that we do in the UK tends to be looking at the profile of chromosome deletions or amplifications. And you'd have heard this thrown around amongst a lot of patient discussion groups and clinicians. We look for 17p deletion, 13q, trisomy 12. And this is just using techniques in the laboratory to see whether there are extra copies of specific chromosomes or some chromosomes that are missing, because this information gives us a broad picture as to how soon a patient might need therapy or how they might respond to specific treatments. We know that some things with patients CLL tend to be stable, and that tends to be this mutational or unmutated status of their immunoglobulin variable chains. That tends to be a feature of the disease. But we do know that as patients go through rounds of therapy, it's not that uncommon for them to acquire additional genetic changes. And a good example of that is the 17p deletion that we can map in maybe as high as 30% of patients can acquire this as they go through 2-3 lines of therapy. Yeah, so this is a really good question, and it's one that needs a lot of communication between clinician and patient to try and help them understand where they are. Because all of these tests are great at population prediction, but they are not really great with that individual because individuals are so variable. And we might talk about an immunoglobulin mutational status or a deletion of 13q, which can guide us if you have 100 patients with that, and you might be able to say, well, okay, 70 of those will still be off therapy by 10 years. But actually, with that individual in front of you, there's so much other variation that it's actually quite difficult to say more than broad sort of ballpark figures.